So I suppose doctors, again, are often faced with decisions around whether or not they feel that a patient has capacity to consent to a particular treatment in their surgery. And I think for GPs, it's very important to understand that in Ireland, a functional test for capacity operates, which means that it's decision specific. So it's about whether the patient can consent to that particular treatment and that at that particular time. So it recognises a hierarchy of complexity. So some patients might be able to consent to simple procedures or treatments, but not to more complex procedures. Other patients might be able to consent to a treatment today and not tomorrow if their capacity is fluctuating. The new Assisted Decision Making Capacity Act, which has not commenced yet, so it's not in force in Ireland as yet, but when I suppose the definition that's contained in that act, and we expect it to be commenced, in the next couple of months, hopefully. But the definition of capacity in that act is functional again, and it talks about that the patient lacks capacity if they can't understand information, if they can't retain it, if they can't use or weigh that information up, or if they can't communicate their decision. So that's, I suppose, a basic test for capacity. The other thing I think that's important for GPs to remember when they're dealing with patients is that there's a presumption of capacity in Ireland. So you presume that your patient has capacity, and that cognitive deficits are only relevant if they impact on that patient's ability to make a decision at that particular time in relation to that particular thing, I suppose, or that particular decision.